Good morning, dear students. Today we are going to learn about the medical procedure that is hysterectomy. What is hysterectomy? Hysterectomy is the procedure of the removal of uterus. So, whenever a person undergone hysterectomy, then that person will not have any more menstrual cycle, and also it is not possible for the person to get any more pregnancy. Okay, so on which all situations a hysterectomy is suggested. When a person, when a woman have some issues with her reproductive organs, some diseases happen to her reproductive organs, in that situation, hysterectomy is suggested. There are different types of hysterectomies present, like total hysterectomy, partial hysterectomy, and a radical hysterectomy. In the case of total hysterectomy, as the name implies, here uterus is removing, along with that cervix also removing. So that is what it is calling like total hysterectomy. Uterus and cervix is removing, and it is the most common type of hysterectomy. And then what about the next one, that partial hysterectomy? In the case of partial hysterectomy, as the name indicate, here the cervix is not removing, only the uterus is removing. And this partial hysterectomy is also known as supracervical hysterectomy. So that is mentioned here. In partial hysterectomy, while detaching the uterus, cervix is kept intact. So many researchers are still going on to see whether it is good to keep the cervix back intact in its position. Is there any benefit of doing like that? So we are just waiting to see what will be the effect. So next and the last one is a radical. It is an extreme type of hysterectomy, and this hysterectomy is usually done in some situations, like if a person have some diseases, critical diseases like a cancer. As a treatment to this disease, doctors are suggesting radical hysterectomy. In this case, majority portion of the reproductive structures are removing, like. Uterus is removing, cervix is removing, upper part of the vagina also removing, and also in some situations, ovary and fallopian tubes also need to be removed in the case of radical hysterectomy as a method to cure the cancer-like diseases. Then what would be the duration of the surgery? It requires 1 to 4 hours. That is the duration. Then need to understand what are the reasons that led to hysterectomy. Abnormal bleeding. So abnormal bleeding from uterus can happen because of so many reasons, like due to the presence of due to the development of some fibroids, PCOD, and all type of these issues may lead to abnormal bleeding from the uterus. And in those situations, extreme case, doctors are suggesting hysterectomy. Then adenomyosis. Adenomyosis is another critical situation in which endometrial, we know it is a lining of the uterus, and that endometrial tissues started to present in the muscular wall of the uterus, and that may lead to bleeding, excessive severe bleeding, pain in the pelvic region. So that is adenomyosis. Adenomyosis, presence of endometrial tissue and the muscular wall of the uterus, and this lead to heavy menstrual bleeding, painful periods, like that. So that is shown here. Endometrial tissues we can see in the muscular wall of the uterus, that is adenomyosis. In that condition also, doctors are suggesting hysterectomy. Then dysmenorrhea, that means painful menses that happens because of so many reasons. In that situation also, hysterectomy is a solution. Endometriosis also somewhat similar situation like that of adenomyosis. In endometriosis also, endometrial tissues are means start to appear outside the uterus, not seen associated with the muscular wall. Instead, it start to appear on other structures outside the uterus like ovary, fallopian tube. So that is shown here, or means on the outer surface of the ovary, fallopian tube, and on the ligaments, that endometrial tissues start to appear. In that situations also, hysterectomy is suggesting. Then in some other cancer conditions to uterus, ovary, cervix, in those situations also hysterectomy is the last solutions, last suggestion from the side of doctors. And heavy or prolonged menstrual bleeding, menorrhagia, that also a situation lead to hysterectomy. Then fibroids, if a person have fibroids in the uterus, so in that situation also, hysterectomy is the only relief from that situation. Then uterine prolapse. Uterine prolapse means there are so many muscles to keep uterine in position. When those muscles become weak, the uterus will descend down to the cervix or vagina. So that situation is uterine prolapse. So in this picture, we can see the normal position of uterus, and as the muscles become weak, it will descend down to the vagina. So in that situation also, hysterectomy only can cure, only can give relief to that patient. And also in the situation of gender affirmation. Gender affirmation means for a transgender to become either male or female, that person need to undergo a hysterectomy to affirm that person's gender. And for the non-binary is also, this hysterectomy is a solution to become either a male or female. Non-binary means that person is not a male or female, that is non-binary. So these are the reasons to undergo hysterectomy. Then we are going to discuss about which are the methods, surgical method to carry out hysterectomy. Abdominal, as the name indicates here, doctors are performing this hysterectomy by giving an incision in the abdomen. Surgeons perform this hysterectomy by giving an incision cut in the abdomen, and that abdominal incision can be either horizontal or vertical. Incision can be either horizontal or vertical below the belly button. And that incision is need to be horizontal or vertical. That is depending upon the um, surgery requirement and also the size of the pathology, that determines whether it should be horizontal or vertical. Then for the abdominal hysterectomy, that patient need to undergo general anesthesia, means complete body should be anesthetized. Hospitalization for 2 to 3 days is necessary, and that incision size is to 6 to 12 inch for horizontal incision, and much more longer size will be much bigger when compared with the horizontal in the incision in the case of vertical incisions. Procedures duration is 1 to 4 hours. Recovery, for recovery after that hysterectomy needs 6 to 12 weeks depending upon the size of the incision that patient have. Then laparoscopy. Laparoscopic method is common nowadays, and we all know that it doesn't need that much size of incision. Here, instead of having a single big incision, doctors are making a few small incisions to insert so many sophisticated equipments through that small incisions. And robotic hysterectomy is a more advanced type of medical procedure using the robotic instruments. So laparoscopy is performed through several small incisions in the abdomen. And through these incisions, surgeons are inserting first an endoscope as a thin video camera. Through that camera, they can visualize the pelvic organs on a video monitor. On a video monitor. And after that, for getting enough space to work in that pelvic region, they are distending the abdominal area by pumping gas to the abdominal area. So that's also another step in that procedure. And again, through other incisions, they are inserting surgical tools to cut and remove the uterus. In robotic hysterectomy, it is the minimal invasive, means it doesn't need that much equipment to insert. It's a minimally invasive uterus removal process, and robotic devices are using to remove the uterus through small abdominal incision in the case of robotic hysterectomy. I will show you one video.
IV will be started. You may
Here it's mentioning about what all steps the doctors are doing on the patient before starting that procedure. IV line and
be given
next.
antibiotics through the IV to decrease your chance of infection. You'll be given general anesthesia. A breathing tube will be inserted through your mouth and down your throat to help you breathe during the operation. Your surgeon will make a small incision near your belly button and insert a plastic tube called a port.
So through this incision, they are inserting a tube and a pump carbon dioxide gas to inflate the abdominal to get enough space to work.
Carbon dioxide gas will be pumped into your abdomen through this port. The gas will inflate your abdomen, giving your surgeon more room to see and move the surgical tools. After your abdomen is inflated, a high-definition camera will be inserted into this port. Your surgeon will make additional port incisions for robotic instruments as well as instruments used by patient-side assistants. An assistant will insert all of the robotic tools through these ports. Unlike standard laparoscopic instruments,
So this means when compared with the conventional type laparoscopic device, these robotic devices are more flexible. It can rotate 360-degree, like means more flexible than our hand. So that is the important thing. That is the advantage of this robotic type equipments over the conventional laparoscopic.
these tools can rotate 360 degrees and have more flexibility than the human wrist. Seated at a special console, your surgeon will operate the robotic arms and the camera with joystick-like controls and foot pedals. A computer will translate the exact movements of your surgeon's fingers into precise movements of the surgical tools. At the same time, a high-definition vision system will provide a magnified three-dimensional stereoscopic view of the surgical area. Depending on your condition, you may have a partial hysterectomy, in which your surgeon will remove your uterus but leave your cervix, fallopian tubes, and ovaries in place. If you have a total hysterectomy, your surgeon will remove your cervix along with your uterus. If you have a radical hysterectomy, your surgeon may also remove your fallopian tubes, ovaries, the upper part of your vagina, as well as nearby tissue such as your pelvic lymph nodes. At the end of your procedure, the tiny incisions will be closed with stitches, staples, surgical glue, or closure tape dressings. After your procedure, your breathing tube will be removed, and you will be taken to the recovery area for monitoring. You will be given pain medication as needed. You may continue to receive antibiotics through your IV. You may be
So these are the procedure of robotic hysterectomy. I think the idea is clear to you. And in that laparoscopic or robotic hysterectomy, here also patient is to need to be given general anesthesia and one night hospitalization only is required here as outpatient. After that, he can leave the hospital, and the incision size is only 5 to 12 millimeter in the case of robotic hysterectomy. Then this procedure will last for what time? How much time is required to complete that procedure? 1 to 4 hours, and recovery, and that patient requires 2 to 6 weeks of rest. The hysteroscopic hysterectomy is another method. And this method, the main benefit of this method is that it doesn't need any type of incision. Here, the uterus is removing through the vagina. So that is the important benefit. But this hysteroscopic hysterectomy is not applicable to all patients. So, hysteroscopic or vaginal hysterectomy is the least invasive approach to uterus removal without making too much invasion to our internal organs. Hysterectomy is possible if we follow this procedure. So how here the uterus is removing through a small incision at the top of the vagina. So there's no need of any abdominal incisions here. And which are the factors that determine whether a patient can have hysteroscopic hysterectomy? So many factors are there. If that patient's uterus is not descending down because of its big size, due to have some fibroids inside, that time this hysteroscopic hysterectomy is not advisable. And also in some other situations like need to remove the ovaries, fallopian tubes along with the uterus, then that time also it will be a tedious task if the surgeon attempt to pull down the uterus through the vagina. So in that situation also it's not advisable. And the experience, it's an also important thing. Experience of surgeon also important to perform the hysteroscopic hysterectomy. And for this vaginal hysterectomy, also it requires general anesthesia and hospitalization for 2 nights, and there is no incision in the abdomen. A small incision only there at the top of the vagina. Procedure requires here also 1 to 4 hours. That 1 to 4 hours is the general duration, I think, for all type of hysterectomy procedure. Recovery requires 3 to 4 weeks. That also common, I think. Then let's see what are the side effects and risk. Most probably it's a safe procedure and success rates are high, even though some risks are there that we need to know. So, suppose if a person have some disease associated with the reproductive part and need to undergo hysterectomy in some early age, then that patient will have early menopause. And that early menopause may lead to so many symptoms like hot flashes. Hot flashes means may experience a high temperature, especially in the upper body parts during night while sleeping. Mood swings, insomnia means improper sleep. And also, we know that one more thing I am telling along with this menopause may cut short the level of estrogen and progesterone, very important hormones that maintain a healthy body situation, like to maintain the bone strength, or like all those things. The proper level of estrogen and progesterone is very necessary. So that also is a major side effect happen because of hysterectomy. Then excessive bleeding, and sometimes hysterectomy led to excessive bleeding, and that excessive bleeding may lead to a situation for that person to have a blood transfusion. Then while doing hysterectomy there is chance to have some injury to the nearby organs like a bladder, intestine, uterus. So that also there is chance to have blood clots to legs or lungs, scar tissue. Whenever some wound happens associated with that, some tissue also may develop. So that's also it's not a good condition. Then hernia. So hernia means the connective tissue. sometimes in some area body parts become weak, and in those areas some internal organs will protrude out, and that may lead to the hernial condition. This also happen associated with the hysterectomy, a severe pain, and as that person got an general anesthesia to undergo this procedure, there's chance to have some reactions and infections. Surely some chance to get infection also, we cannot rule out. So these all the general things about hysterectomy. I hope that you got a brief idea about the medical procedure. With this, I am going to wind up today's section. Thank you.
I'm an icon, man. And my girl about a 10. I should fuck her in a Benz.